Also like fear, I think, for folks about like, does going to sex therapy mean that me and my partner are gonna have to make out in front of my therapist? And like, okay, hi everybody. Thanks for coming back if you've been here before, or hi, welcome if you're new. My name's Mickey, I'm a therapist, and we talk about therapy things on this channel. Today, we're talking about sex therapy because we talk a fair bit on this channel about sex and intimacy and relationships, and also obviously about therapy, but I don't think we've ever talked about those two things specifically together. So I want to talk about that because the common questions about sex therapy are, one, like, what actually is sex therapy? What does that mean? And two, how do you know if you need a sex therapist? So I'm answering both of those questions for you today. Before we get into it, I want to be clear that this content is intended to be broad strokes, learning and education. This is not therapy. It can't be therapy. Never was therapy. However, if you want to find a therapist of your very own, there are always links in my description for you to go do that. So that's it. Let's talk about sex therapy. First thing that I want to talk to you about and be clear about is that sex therapy is actually pretty common. Between 30 and 40% of people report some type of sexual dysfunction within their lifetime. So I think it's really important to just be clear and like level set at the outset here that experiencing difficulty, discomfort, anxiety, fear, trauma, complications related to sex, intimacy, physicality, regardless of whether it's partnered or individual, is in fact a fairly common human experience. And this is a morally neutral thing. It's not a shameful thing. It's also not something that should be embarrassing, in the same way that we will, I think most of us, if not all of us, need help, guidance, some kind of official support around like anxiety, fear, trauma, depression, mental illness generally throughout our lifetime. Sex is simply another aspect of human life and relationships that can be fairly common. And so needing help and official like formal support around that, again, is like a pretty morally neutral but also common thing. The second thing that I want to clarify with you is that actually being clear about what we're referring to when we say sex therapy is important here, because sex therapy is sort of unique in the aspect that you can be a therapist who is sex positive, who has like educated yourself about therapy, but is not specifically a sex therapist, right? There is an organization called ASECT, which stands for the American Association of Sexual Educators, Counselors, and Therapists, that generally speaking is pretty well regarded as like the organization that doles out certifications to be a licensed sex therapist. The reason for this is that the requirements to be an ASECT certified sex therapist are pretty stringent. I looked at it actually because I was like, maybe I'll do that. It's a lot. You need to be a independently licensed clinician with at least 2 years of experience in practice, but then you also need to have like supervised hours and take formal courses and official education, like all these things, and then you have to apply and then be approved and like with letters of recommendation and the whole thing, right? Like it's very intense. It's very involved. That's not the word I'm looking for, but close enough. It's a pretty involved process. The reason that this distinction is important is because these two things are not the same. And while again, it is morally neutral and like I think good to be a therapist who just educates yourself generally about the human body and sexuality and all of those things, it's not the same as being somebody who specializes in, whose bread and butter, whose like particular focus as a clinician is in sex, relationships, intimacy, those things. As a person who is not a certified or ASECT certified sex therapist, but has taken like continued education courses about sex, this is also an important distinction from a clinical or like from the clinician perspective, because should I find myself in a situation where a client in like having discussions about the evidence-based practice around sex and intimacy and relationships presents with an issue that I know I'm not equipped to treat, we then need to refer that person to somebody who is certified with the appropriate credentials to be more heavily involved in that topic, right? It's like a pretty vast thing. And so this certification is important, especially because we're going to talk later about like, how do you know if you need sex therapy? But depending on the issue and like the presenting problem here, that's going to be an important distinction to say, like, is it enough for me to just talk with my own therapist maybe, or a therapist who happens to know more about sex and intimacy, or do I need, or me and my partner or partners need a therapist whose, again, bread and butter, everyday practice is in guiding folks through sex or sexual dysfunction. Before we talk more about that, I want to talk to you about this week's sponsor, which is Beducated. I'm so excited to work with Beducated again. For those of you who don't remember, Beducated is an online platform that is dedicated to all things sexual wellness and learning. They have over 100 courses from the world's top experts about sex and intimacy. And one of my favorite things about Beducated is the healthy amount of variety on the platform. When I say that there is a course for everyone, I am being so serious. Lately, I have been taking the course actually about chronic illness or chronic pain and sex, because for those of you who don't know, I have chronic pain and it can be kind of a boner kill sometimes. So I've been really enjoying taking the course to broaden my understanding and horizon about what a healthy sexual relationship can look like, while also being honoring of your very real limitations and needs regarding chronic pain. Beducated has truly been a game changer for me, and I think that it will be for you too. So go click that link in the description. If you use code Mickey Atkins, you can get 50% off of the yearly pass. And Beducated also has a 24-hour risk-free trial, meaning that you can like test the waters and really dip your toes in, see if you like it. And if you don't, then it's like no questions asked. It's super easy. They also have a 14-day money-back guarantee. So like, what is the risk? You know, I think there's really a lot to gain and nothing to lose here. So go click the link in that description, check out Beducated, use code Mickey Atkins, and show Beducated some love for showing me some love. Thank you again to Beducated for sponsoring this week's video. Let's go ahead and hop back in. Oh, also I want to pause here and make the distinction as well that there are folks who are like sex coaches, right? I've talked a little bit on the channel. I don't know that I've made like a dedicated video about the difference between therapy and coaching. It's contentious. I don't think there's anything wrong necessarily with people being life coaches and things like that, although there are very much people who are not honest about their credentials and can misrepresent things and also practice things that aren't evidence-based practice as like life coaches. So in the same realm that I want to encourage people to be conscientious consumers about the life coaching industry generally and to really look closely at what that person's credentials and experience is before engaging with a life coach, the same thing goes for sex coaching versus sex therapy. It's not that there aren't valid and educated and safe and good people who are sex coaches. It's just that the Venn diagram of people who are charlatans is going to be a little bit like wider in this field than it is in sex therapy specifically. Okay, so I want to talk to you about the actual question of what does sex therapy look like? I think there's a couple of things that are super important for us to clarify from the jump here, which is that first and foremost, sex therapy should be inclusive always, right? This means not just being inclusive of LGBTQ plus people, but especially being clear that sex therapy should never be a vehicle for one partner to try to force another partner who is asexual to be sexual, right? Sex therapy is inclusive, it's also evidence-based, and it's affirming of queer and LGBTQ plus people. So sex therapy should never be a vehicle, or especially like just generally speaking, it should never be a thing that we're trying to leverage in a relationship to force a partner to be more sexual because we want them to be. It should be an intervention and a tool and a process that's validating and uplifting and feels safe and affirming for all involved parties. It's also important to clarify here that sex therapy is not just for couples, right? It is entirely possible and realistic, and I would say like not abnormal for someone to attend sex therapy as an individual because your interest or desire or need is to improve or expand your own sexual relationship with yourself, or especially to deal with things like sexual trauma, sexual dysfunction, for, again, not just as a couple, but for yourself. Oh, another caveat here is that in my opinion, sex therapy should also be free of any like religious undertones, and especially like the moral imperatives and moral policing things. In my opinion, generally speaking, it is possible for therapists to be folks of a particular faith and still be good therapists, right? But with sex therapy, especially if we are enforcing the idea that like, oh, I'm a sex therapist, except that I believe that sex should be like segregated up until marriage, yuck. Like a good sex therapist, especially one who is certified by like ASECT or an appropriate entity, should not be policing your morality or telling you that you're a bad or sinful or wrong person for engaging with sex or intimacy in the way that works best for you and also feels safest to you. Which also goes along with my next 2 points, which is that sex therapy should also be an evidence-based practice, even for folks who are not ASECT certified or licensed sex therapists. Therapy generally should always be based in evidence-based practice, and it should also never include actual sexual conduct or contact with the therapist. This is a common misconception, misunderstanding, and also I think fear for a lot of folks, which is that it is never appropriate and it should never happen that your therapist asks you or your partner to be sexual in the office. The therapist should never be sexual towards a client ever, and sex therapy is not an exception to that, right? We're going to talk later about what some sex therapy homework stuff might look like and what the actual interventions might include. However, I want to clarify that from the outset because again, there's a common misconception and also like fear, I think, for folks about like, does going to sex therapy mean that me and my partner are gonna have to make out in front of my therapist? And like, no, Jesus, no, that's never appropriate. That's not how it's supposed to work. Similar to how, typical talk therapy works, really what we're talking about here is a type of therapy that's more so just guided in its focus about sex and intimacy and relationships, right? So there might be frank and honest discussions about about your sexual history, your sexual patterns, like initiation patterns, types of experiences and pleasures and interests that you or you and your partners have explored, what that looks like, but also like a frank and open discussion about our values, our beliefs, our wants and needs, our sensitivities or issues surrounding the topic of sex. This is especially useful for folks who have survived sexual trauma, because we often carry a lot of subconscious or implicit beliefs about sex or about shame, especially around sex. And so sex therapy oftentimes includes a greater conversation about these things and really trying to make like the unconscious assumptions about sex more conscious, more explicitly spoken, so that we can have a conversation about like, how is that belief serving you, for example, or is it serving you anymore? Is this potentially a thing that's creating a barrier either for you as an individual or again for you with partner or partners? Okay, I have a list for you here. I think it goes without saying that this is far from exhaustive in the way that therapy is sort of vast and amorphous and can include a discussion of lots of different things. Sex therapy is not an exception in that regard, but I wanted to give you like a general list of like what you might talk about if you end up going to sex therapy. So generally speaking, especially conversations about sexual dysfunction can include talking about things like physical sexual dysfunction, like erectile dysfunction, or a lack of or decreased vaginal lubrication. This can also be discussions about low desire or no desire, low arousal or no arousal, pain or discomfort during sex, even a lack of skill. This is a thing that surprises a lot of people, is that sex therapy can be a great learning opportunity for folks who feel like, especially in a partnered context, for example, that like my partner seems to struggle with the skill implementation of this particular thing, and that's become a barrier in our sex life, which we then feel disconnected from one another. And so conversations about best practices in regards to skill and anatomy and pleasure can very much be conversations in sex therapy. It can also be a conversation about difficulties or dysfunction with orgasm, so orgasming too quickly, not being able to orgasm, having difficulty with orgasm, or orgasm not being particularly satisfying. And then also obviously like just general conflict or discord in regards to the topic of sex or intimacy. And again, all of this is either for partnered sex or for sex with yourself. Also, really quick, I don't know if you guys can hear the noise that's happening around me. I don't know what's going on. I think we're power washing the roof today. I'm not joking. So if you can hear that, I'm really sorry. We're trying to record around it, but like, it is what it is. I want to talk to you about what some of the homework assignments can look like in sex therapy, because similar to traditional talk therapy, you can also be receiving homework assignments during sex therapy. And some of that can look like trying partnered or individual exercises, obviously within the privacy of your own homework or space, watching instructive videos or reading instructive or explorative books and articles, some of which can be explicit. I wanted to pause here and also talk about or like remind you guys about Beducated again, because I know I talk about it a lot, but like this platform existing with content, like I talked about, that like is specific and instructive and like sometimes explicit, is such a valuable resource for folks. Shout out to Beducated again if you're looking for that. The other types of homework assignments here can be genuinely just like a discussion, right? Like an encouragement from your therapist or clinician to engage, especially like in a partnered context, engaging in a discussion about reflections or thoughts that we've had, especially having a greater conversation about like, how was that session for you? What came up for you? The general unpacking process there, and encouraging an open dialogue in regards to the issue is a pretty common homework assignment in therapy generally. But for sex therapy especially, this can be really useful and transformative. One last caveat that I want to include here about sex therapy is that it is also entirely possible for it to be multidisciplinary. What this means is that it's somewhat common, I would say, for therapists, especially now in this day and age, to be incorporating a greater focus on creating a team of experts to help address a particular issue. And this is really important with sex therapy because sometimes sexual dysfunction can be a result of physiological or hormonal or medical issues, right? And so having a team or like a multidisciplinary focus where we're referring out to a physician or a medical doctor to address whatever issues are present there is really important, and sometimes something that can happen in sex therapy. The last thing that I want to address here is this question of like, how do I know if I need sex therapy? Because it's a common question and a subject of a lot of anxiety and discomfort for folks, but this comes up a lot with even just the conversation around regular therapy, which is why I wanted to talk about it. We have talked on the channel before about this question of like, how do I know if I need a therapist, or like, is it time? And sex therapy, in my opinion, is really not all that different. First of all, because if we're having that question, especially if it has come up for you more than once, it might be worth making the phone call or sending the email to say, hey, hi, my name's so-and-so. This is a very brief description of the interest that I have in this type of service. Can we do a consultation to discuss whether or not this is a good fit, right? In my opinion, any therapist who is worth their weight in salt will be willing to talk with you for a 15-minute or 10-minute consultation for free to assess, first of all, like a goodness of fit, right? Is this like person to person going to make sense for us? But also, are the issues that you're, thinking or like wanting to get addressed a good fit for my practice as a clinician specifically, for the institution of therapy generally? And this is really not all that different for sex therapy. So if it's coming up for you again and again, I do want to encourage you to give yourself the space to say, I don't know, like maybe it's okay for me to send the email or make the phone call and just ask the question, right? Because again, it's frustrating to me that this onus gets put on the consumer of therapy a lot to be the person who decides whether or not you're like worthy or like ready. In my opinion, first of all, that's a therapist's fucking job because like that's our whole job. But second of all, there's no harm in asking the question. It's not going to hurt anyone to have a 15-minute consultation. And so again, if it's coming up for you, do give yourself the space to do that if you would like to. The other thing that I think is important to acknowledge here too is that for folks who already have an established relationship with a therapist who's like maybe not actually a sex therapist, but just like is your therapist for other stuff, that's a perfectly okay question to ask there too. I know that this video is specifically about sex therapy in like the more formal context, but I also wanted to talk about the fact that therapists, clinicians, counselors, social workers, we should be people who are, first of all, destigmatizing the topic of sex and intimacy. While I am not an AASECT certified sex therapist and it is not the primary focus of my practice, I do very much sometimes host conversations with clients from an evidence-based practice and scientific perspective about questions, confusions, misconceptions, and especially shame that folks have, right? I have taken continued education units in the hopes of making myself a more qualified clinician, especially in regards to helping people through sexual trauma and things like that. My practice tends to be more trauma focused than anything, but the point that I'm making here is that therapists should be people who are, first of all, able to talk about these things from an evidence-based and scientific perspective, but also people who are safe for you to do that, right? So if you already have a therapist and you're like, I don't know, maybe I should go to sex therapy, or maybe this is something that could be helpful for me, please know that your therapist is not going to be like, we don't talk about that here, or at least they shouldn't be. Anyways, if your therapist does that, that's very rude and also not helpful. Especially too in the realm, I think I talked about this in a video a really long time ago. Therapists have really seen some shit. Like we've heard so many things. It's super, super common, especially because we are the safe people. We are the secret keepers for a lot of folks. It's really common for us to just get like doorknob confessions about things that people have never shared. The like lingering questions about like, is this anatomy normal? Is this sensation common? Do other people feel this way? Lots of stuff like that comes up as therapists. And it's a thing that like, in my opinion, if you're going to be a therapist who is choosing to take on the role of being a safe person, you should be willing to navigate conversations about this in an ethical way, in a safe way, in an evidence-based way, but that still is validating and like honoring that like sex for some people is a part of life that's important to them, right? And so we can talk about that in the same way that we can be validating of somebody having like a diarrhea incident or somebody having, like a really embarrassing social anxiety moment, like whatever, right? It's an aspect of life that like, in my opinion, it's the therapist's job to work on their own discomfort or embarrassment or biases around sex so that we can hold space for that in a non-judgmental and like unaffected way. As a final consideration for the rule in, rule out conversation in regards to sex therapy, I want to encourage people to remember too that anything that's not being easily resolved by a non-therapeutic intervention might be grounds for involvement with a therapeutic intervention, right? So if you've had an issue that's related to sex or intimacy or relationships for like a long time, or an issue that doesn't really seem to be resolved by issues or by supports that aren't specific therapy, please know that that is also something you can include in a phone call or an email to say, hey, had this issue, have been working on it outside of therapy, but it doesn't seem to be getting better. So I'm hoping that getting some formal and official support from a professional might help me resolve it, right? That's very normal. And for a lot of folks, that's kind of the point at which we're like, it might be time, right? And that's very normal. That's very okay, especially because the truth is that therapy is for everyone, right? I've talked about this on the channel too, which is that I really disagree with the perspective that you have to be sick enough for therapy. Ew. Therapy is for everyone at all stages of their development in life and at the severity of their issues. So you don't need to be the sickest person or somebody who is struggling the most. It is perfectly okay. I would argue it's like actually really helpful to gain formal support and involvement from a therapist before we get to the point that like the train is off the tracks, you know? Want to be clear, that's morally neutral too. Therapy is not an accessible resource for all people. So sometimes we do show up to therapy when the train is already off the tracks. Therapists are fine with that too. But for what it's worth, I want to destigmatize people being able to go to therapy at the point that you're at. You don't have to wait until it gets worse. You deserve being given a seat at the table. And there are very much therapists who do work with folks like that, who want to work with folks like that, who specialize in therapy like that. So if it's a thing that you're thinking about, generally speaking, when you're in doubt, send the email, host the conversation, have the consultation, because again, therapy is a resource that should be accessible to everyone. And again, there are therapists who would be happy to work with you and would be like very safe and wonderful and validating people. I know that this topic is like pretty heavy and loaded and that there will be thoughts and feelings for folks. Please leave me those in the comments. It goes without saying again that this is a non-exhaustive conversation about this issue, especially again because I am not a certified sex therapist. So there is definitely resources in the description for you guys to go check out some other stuff that is from licensed and credentialed sex therapists if you'd like to do that. But generally speaking, if you like the video, you can subscribe. We do talk about stuff like this, and we also do a fun pop culture moment. We've been live streaming reality TV on Fridays, by the way, to talk about all of the problematic stuff that ensues there. So if you want to come hang out with us in real time, you should do that. But in the meantime, you can share the video to help the channel grow and to help each other grow, and I will see you guys next Saturday. Okay, bye.